welcome to Nursing with Professor B. My name is Bridget. I have a master's degree in nursing education. I'm also a family nurse practitioner. In today's video, I'll be doing a short review in order for you to pass the 2021 BLS test. My 2020 video was seen more than 40,000 times and it helped thousands of people pass the BLS test. So without further ado, let's get started. But before we get started, make sure you hit the like button, make sure you subscribe, and make sure you turn on that notification bell. Let's go. CPR, BLS, infant, child, and adult cheat sheet. This video is for educational purposes only. If you have a question about a medical condition, please consult a qualified healthcare professional. The content in this video strives for 100% accuracy, but errors may occur. Thank you for watching. First of all, I know this material can be a little bit dry, but we will get through this together. All right, so the first thing that you need to remember is you want to think of CAB, compression, airway, and breathing. That is the order that the AHA now recommends. So the number one thing you want to do, Charlotte is back from last year, is Charlotte is laying on the floor. You want to check for unresponsiveness. So hello. They always, when you're doing this scenario, like the simulation, they'll have a mannequin on the floor. You tap the mannequin on the floor and you say, hello, can you hear me? Are you okay? And then if no response, you proceed with assessment for patients of all ages. So if no response, immediately have someone specifically, if you're in a crowd with someone, if the scenario is that you're in a crowd, you're going to ask one person, you're going to point to them and say, you call 911, and then another person, you go get the AED. You want to tell someone specifically to call 911 because if there's a lot of people, there's a thing called the bystander effect, and everyone else will assume that they call 911, and then nobody calls 911. So number one, right away, activate 911, get someone to get an AED for you. If help is around, request their assistance to activate 911 emergency system and get the AED. So if you're by yourself, call 911, go run, get an AED. You want to check for a pulse and you'll check on the carotid for an adult. This should take at least 5 seconds, but no more than 10 seconds. That's on the test. You should check for breathing during this time. You want to check patient to see if they are breathing, or not breathing normally. Agonal gasping is not considered breathing. That's also on the test. Agonal gasping is not considered breathing. So then you would initiate CPR and you would start CPR beginning, remember with CAB, you would begin with chest compressions. The compression rate is at least 100 to 120 compressions per minute with hand placement at the mid-nipple line, lower half of the breastbone. And they do ask on the test the depth, and they do ask the compression rate. So the song you can think of is staying alive, It's 100 to 120 compressions a minute, okay? And you want to go at least 2 inches, but no more than 2.4 inches. At least 2 inches, that's usually on the test also. All right, now how do you classify a child? A child is from 1 year to signs of puberty. Again, with them, you start CPR beginning with chest compressions. For children, for the compression rate for children is also at least 100 to 120 compressions a minute, also with hand placement at the mid-nipple line, lower half of the breastbone. And compression depth is at least 1/3 the depth of the chest, about 2 inches. You don't want to go the 2.4 in adults, but you want to go about 2 inches with children. Infant is considered from birth to 1 year. Infant is from birth to 1 year. And you start CPR beginning with chest compressions also. So everybody is CAB. So make that easy, right? Now, also the compression for infants is at least 100 to 120. So that's everybody. A minute with hand placement also at the mid-nipple line, lower half of the breastbone. Now, the depth for infants is different. It's about 1.5 inches. So 1.5 inches for infants. This is on the test. You want to allow for full chest recoil between compressions. So if the heart was just compressing like this, like an atrial fibrillation, right? It doesn't fill enough. The heart needs to The heart needs to relax, so that's why it has diastole to fill, and then systole compresses. So if you're just pump, the poor little heart doesn't have time to fill. So remember on the test, that's why the chest compressions, staying alive. You need to allow full chest recoil. Like I said before, that's on the test. You need to allow full chest recoil between compressions, and this allows the heart to adequately fill between each compression. You want to minimize interruptions in chest compressions. So minimize interruptions in chest compressions. As recommended that interruptions be limited to less than 10 seconds. The only time really you're going to be interrupting is when you're rotating between compressions. Now, you rotate the person providing compressions every 2 minutes. You rotate the person providing compressions every 2 minutes. If no trauma is suspected, you can utilize the head tilt chin lift, so you can actually move, but you don't want to move someone's spine if there's been trauma. So if there's suspected trauma, you utilize the jaw thrust maneuver where you thrust their jaw forward, and that also helps open up the airway. Now, compression to ventilation ratio, this is on the test. For a single or multiple rescuer in adults is going to be 30 to 2, okay? So 30 compressions to 2 breaths. It doesn't matter if it's a single rescuer or multiple rescuer. Now, in children and infants, 1 rescuer is also 30 to 2. However, if there's multiple rescuers in children and infants, then it's 15 to 2, and that's usually in the test. If there's 2 people doing resuscitation on a child or an infant, it's going to be 15 compressions to 2 ventilations, to 2 breaths, okay? Ventilations with advanced airway, this is more ACLS, so I'll cover it quickly. When you have an advanced airway, you ventilate the patient 1 time every 6 seconds for a total of 10 per minute. And this is on the test. You always look for visible rise of the chest to confirm adequate ventilation. You want the chest to rise, not the abdomen to rise. If the abdomen is rising, then the airway is not properly placed and you're seeing gastric inflation. So always look for the chest to rise. With defibrillation, once someone gives you the AED or you get the AED, you use it immediately. You don't wait, immediately. And immediately upon defibrillation, you start CPR beginning with chest compressions. That's a change from, maybe 10 years ago. After 10 years ago, they would say, oh, after you defib, you want to check for a pulse. No, they're saying right away. So shock delivered. So as soon as you hear shock delivered, boom, 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 you start right away with CPR. You don't stop. You don't check for a pulse. All right, basic life support for healthcare providers. High quality CPR will increase the chance of victim survival. I'm not sure why the slide looks this weird. Probably because I'm doing this in PDF version versus the actual presentation. But anyways, so you start compressions immediately after confirmation that a patient has no pulse. Okay, important, no pulse, that's when you do compressions. If there's no pulse, you do need to check for a pulse. Again, repetition is the mother of learning. This will be on the test. This should take a minimum of 5 seconds, but no more than 10 seconds to confirm, okay? You want to compress at a rate of 100 to 120 per minute for all patients. You push to a depth of 2 inches on adults and children, 1.5 inches on infants. Remember, infants is different. You allow for full chest recoil. This will ensure the heart can adequately refill in between compressions. You provide breaths until you see visible rise of the chest in all patients. You want to avoid excessive ventilations as this can lead to decreased blood flow. All right, seems like common sense, but the first thing you want to do when you get the AED is you turn it on and then follow the prompts. The prompts make it pretty simple, and there's pictures in there. So when the AED becomes available, you immediately use it. This is the only time that stopping CPR at the mid 2-minute cycle is appropriate. After this point, you will only use the AED on the 2-minute pause pulse check. If the AED analyzes and determines the victim requires defibrillation, do so only after clearing all bystanders and healthcare providers from the victim. So when you have the AED, it will say analyzing rhythm. And then it'll say something along the lines of shock advised. So you want to make sure that nobody's touching the patient. So you can say something along the lines of all clear, and then you press the button and it'll say shock delivered. Immediately upon defibrillation, once again, you're going to resume CPR beginning with chest compressions. Now, I'm not saying you can use the AED on someone that is submerged in water. I got a few nasty comments on my video from last year. What the regulations say is that the AED can be used on a victim that was submerged in water. So you first remove the victim from the water. Obviously, you're not going to like put the AED on them in the middle of a pool. You're gonna take them out of the water. You're gonna wipe them down. You wipe the victim's chest, and then you can proceed to put the pads on them. The AED can experience difficulty if the victim's chest is hairy. So when possible, the victim's chest should be shaved with a medical razor or pads firmly placed to ensure chest contact. So if someone is extremely hairy, there should be a razor in the AED for you to be able to shave them. If there's not one, then make sure you're aware of how many pads are in the AED. There should be a pediatric set and an adult set, right? So if there's 2 pediatric pads, you could use both of the pediatric pads to give them like a chest wax. But obviously you would not use your last set of AED pads to rip the hair off of someone if you don't have anything else. So be cognizant of what you have in stock, of what's available, and use common sense. Adult pads should be used on adult patients. Don't use pediatric pads on adults. Those that are less than 8 years of age should be using pediatric pads. If pediatric pads are unavailable, what you can do is you can put one adult pad in the front and one adult pad in the back, depending on how small the child is. So you can use adult pads for children, but they can't touch. So if the child is small and the AED pads are touching, that's where you have to do one in the front and one in the back. The child age range for the use of AED is 1 to 8 years of age, and child age range for CPR is 1 year to signs of puberty. The AED can be used for a patient lying in snow. You want to, again, clear the victim's chest, and if it's wet at all, you want to wipe it down. If there's a foreign body airway obstruction choking victims, what you want to do is, in a responsive choking adult, you want to perform abdominal thrusts until the item is dislodged. If the patient becomes unresponsive, that's when you assist the victim to the floor. So you keep performing those abdominal thrusts until they lose consciousness. Once they lose consciousness, you assist the victim to the floor, you carefully support their head, you activate the emergency response system, and you start CPR beginning with chest compressions. The keyword is responsive, in a responsive choking infant, perform cycles of 5 back slaps. You're going to do it with the heel of your hand, and you're going to do a football maneuver here. 5, you're going to do it almost like in between their shoulder blades. So 1, 2, 3, 4, 5, followed by 5 chest thrusts. 1, 2, 3, 4, 5. You perform this for a total of 3 rotations, and then you recheck the infant's mouth to see if the item has been dislodged. If the victim becomes unresponsive, you activate the emergency response system and you start CPR beginning with chest compressions. Child or infant with a decreased heart rate. If a child infant has a pulse rate of more than 60 beats per minute but is not breathing, the rescuer should begin rescue breaths at a rate of 1 every 3 to 5 seconds. If a child infant has a pulse of less than 60 beats per minute and is not breathing with signs of poor perfusion, so if this little child looks blue in the face, then the rescuer should initiate CPR beginning with chest compression. So again, CAB. All rescuers should ensure the scene is safe prior to approaching a patient. That's usually on the test also. You want to make sure that you're not going to get electrocuted or something, like be aware of your surroundings. All rescuers should ensure the scene is safe prior to approaching a patient. If the victim has no pulse and is not breathing, CPR is required. Again, no pulse, compressions. When assessing a pulse, limit checking to no longer than 10 seconds. This is like the third time this has been in here, again, because it's a test question. You palpate a pulse on the adults at the carotid artery on the either side of the neck. You would never check both sides because then you're blocking off. This is more of a nursing question. You would never check both sides of the carotid artery at the same time. You're blocking blood flow. The person could pass out. You want to palpate a pulse on infants at the brachial artery. This is on the underside of the bicep. Blood flow is needed to perfuse the patient's brain, and this is why we compress to a depth of 2 inches in adults and 1.5 on infants. Remember, it's 2 inches in adults and children, 1.5 on infants. And all patients, doesn't matter their age, all patients should receive 100 to 120 compressions per minute. The rescuers providing chest compressions should alternate every 2 minutes. When one rescuer is providing chest compressions, the other one is breathing. When performing chest compressions on an infant single rescuer, the 2-finger technique should be utilized. When performing chest compressions on an infant with 2 rescuers, then the 2 thumbs encircling hands technique should be utilized. So you encircle and then you press down with your thumbs. So you encircle the infant and you press down with the thumbs. All right, compressions, adults 30 compressions to 2 breaths. 1 rescuer on a child or infant is 30 compressions to 2 breaths. And remember I said earlier, I think this was like the first page, that if you have 2 rescuers, multiple rescuers on a child or an infant, it's 15 compressions to 2 breaths. So you do 15 compressions, breath, breath, 50 compressions, breath, breath. Remember that no suspected neck injury, there you can do the head tilt chin lift. But if there's suspected neck injury, you want to immobilize the spine. Only the jaw thrust maneuver is utilized. To provide adequate breaths, you should seal the patient's nose and mouth when providing breaths. On an infant, you can put your mouth over their nose and their mouth at the same time. If a child is larger, or on an adult, you can pinch the nose and breathe into the mouth so that the breath doesn't come out of the nose. A lot of times, I used to be a lifeguard, we would have that one-way valve that actually provides a seal. The AHA wants us all to be safe. So they say we should use something when we're providing CPR. I walk around with a face shield on my keychain just in case I ever have to do CPR. I recommend you get one. If no method for safely providing breaths is available, so you don't have a bag mask, you don't have a pocket mask, you don't have that one-way valve that lifeguards have, then hands-only CPR should be used at a rate of 100 to 120 compressions per minute. I don't remember if this was on the test. All right, breathing. Once again, visible rise of the chest is a key indicator that breaths are effective in all patients. You don't want to provide excessive ventilations. It can cause gastric inflation. When you're only doing rescue breaths, you're not doing compressions, then adults should be ventilated once every 5 to 6 seconds. Children and infants should be ventilated once every 3 to 5 seconds. Remember that children tend to breathe a little bit faster than adults. With an advanced airway in place, compressions are constant with no pauses, and ventilations are provided once every 6 seconds for all patients. Yay! We made it all the way to the end. For a free copy of this PowerPoint, send a screenshot that you subscribed to my channel, that you liked it, that you turned on the notification bells, to nursingwithprofessorb@gmail.com. Thank you so much for watching. Best of luck. Leave me a comment below if you passed your BLS test. Alrighty, until next time.